January 22nd, and this is afternoon of House Healthcare Committee. We're going to continue with H35. That's the act regarding merging the individual and small group markets. And first up, we have Mike Fisher.
Like I never hear.
It's going to be like deja vu for us from this morning, I think.
Good afternoon, Mike Fisher, healthcare advocate. I was thinking after this morning that I would try and fly on a much higher level and just really clearly state that the HCA supports this bill as drafted. Our position on, maybe I should say my position on whether it makes sense to keep the markets together or apart has changed over the years as other things have changed. But the current dynamic, with, with the available things that we can do to support the individual market, and the really tremendous stress that the small group market is under, it leads us to have the position that it makes sense to maintain a separate individual and small group. And I should also say there's a number of other details that Diva asked to be a part of this bill that all make sense to us too. I am happy to go into more detail than that, but I don't want to give anyone a post-traumatic stress response. No, I'm happy to go into more details or respond to questions.
Is there anyone that would not be for this?
I was actually just saying this. I'm not aware of anyone who's opposing this.
That's what I was thinking. Okay.
And nor can I think of anyone who might.
I know. Okay.
Let me ask, so, because I did neglect to ask Diva this morning, all the other changes, just the technical changes, you're fine with all of those. We keep forgetting that there's other pieces of this bill which are just technical changes. To your point of you can't think of anyone who wouldn't be. In light of some things that you said this morning regarding being unsure about what will happen on the federal level, we will be faced with possibly some catastrophic thinking, some things happening in the individual market. I was wondering if you could speak to those at all. And
yeah,
I mean, I do think it's something that we have to weigh.
Yeah. Let me be perfectly clear that my concerns about what is coming next, for 26 in the individual market, doesn't change my position on this bill. But yes, absolutely. The 26 looks to me like it will be a even harder year for us to figure out how to make sure people have access to health coverage. I want to remind you that you have this really interesting detailed report that came to you last week, and it lays out a number of options and complications for each of those options and funding needs for each of those, for any of those options. So I do think that is the place where it's really going to make sense to think about sort of how do we protect Vermonters as best we can. And I'm also, I should say, I read that report with some curiosity of, I'm looking forward to the governor's budget recommend. Is that Tuesday? I sure hope that the recommend addresses this. because we really are going to need, we're going to need the governor's thinking, the administration's thinking, and your thinking about how to best move forward. And, in particular, we continue to have this Vermont premium assistance, and it sort of fills an interesting role of sort of backing up the federal premium assistance. We buy it up by 1.5%. But that tool may be a useful tool to be able to think about how to sort of protect parts of the population that are going to be, that may well be losing the federal premium tax credit subsidies.
Could you talk just a little bit, because I know that you know all of this stuff. Can you talk about what was in existence before 2020 with the enhanced tax credits? What was the playing field like at that time for tax credits?
I managed to not bring my computer with me with the chart that I showed you this morning, a reference this morning. Before the enhanced premium tax credits were the tax credits as defined in the Affordable Care Act, which were good and really did support a broad swath of Vermonters. But a major shortcoming of the Affordable Care Act was the cliff at 400% of poverty. And so under the Affordable Care Act rules, people who earn over 400% of poverty lose all of their premium tax credits. And pre-enhanced tax credits, that represented a really disastrous cliff. And we've been playing with some numbers. I'm not going to say it. We think that if the cliff comes back, if the 400% of poverty cliff comes back, that we'll see cliffs of $25,000 or $30,000. And so people who earn just a little too much for the subsidy will lose substantial tax credits.
And I'm looking at a chart provided in that report. We're talking currently, I believe in 2025, they have approximately 5,800 people who are estimated over 400%. So of that market, the individual market of about 32 or 34,000, we're talking about around 5,800 people that would lose any tax credit, all their tax credit. Brian, did you?
Yeah, you said there would be a cliff. You said 25 to 30,000. Can you explain what you mean a little more?
I mean that what I really mean is that the value of today's tax credits to somebody just over 400% of poverty. And I should always be prepared to do this. The poverty level is just a little over $15,000 for a family of one. So 4 times that for a family of one. For somebody who earns just over that, the subsidies are significant. The subsidies are worth thousands of dollars. And
Yeah, I'm just trying to understand so like you said that the difference could be $25,000 to $30,000. So what I'm trying to understand is if someone makes like $45,000, are you saying that going $1 over or whatever is going to make their insurance is going to cost $25,000?
so let me say the worst case scenarios for a family of 4 earning just over 400% of poverty could represent, yes, those kinds of numbers of loss of subsidy.
And it's because the family plan costs more than the individual plan. That's how you get those numbers.
Well, certainly the family planning costs.
Yeah, yeah. 'Cause I'm trying to understand, like, because I know insurance is expensive and I know I get the tax credits and if I didn't.
But in this case, I'm comparing the cost of the family plan with the subsidy, at 400% of the federal poverty level versus the cost of the same plan, without the subsidy at 401% of the federal poverty level. So somebody who earns just over loses, in the Affordable Care Act rules, loses all of their premium tax credit subsidies. And this, let me be clear, this is something that is completely out of our control. The federal government needs to take action if we're going to continue to have the subsidies. Being responsive to the chair's question represents a substantial risk to Vermonters' access to care.
Easy?
So we're talking about the premium tax credits. Can I give an example and you tell me if I'm on the right track with understanding how this relates? So a family of four at 400% is who those premium tax credits are potentially at the end of this calendar year. The tax credits may go away.
Insurance, yes, this is for 2026 calendar year, yes.
Okay. So that family of four at 400% would be making around 124,000 a year. And they would then have to pay $20,000 more for that same insurance plan.
Yeah, let me do a little bit of work of getting a chart in front of you so you can see our modeling. We did a very quick look at it.
Rough estimate. Okay,
yes.
and the second part of the question is, that's separate from what the bill does, right? The bill has nothing to do with that.
That's correct.
Okay, just to be clear. And then nothing to do with that. So it's kind of a separate discussion. This bill doesn't impact anything to do with the credits. But can you kind of weave that together for me? Like, why are we talking about the premium tax credits while we're talking about this bill, which really just keeps things the way they are? Like, is anything that
the reason
the bill going to make insurance more expensive for people?
No, the bill won't make insurance more expensive for people. The bill will maintain the status quo. Not saying insurance is going to cost the same amount next year. It's going to go up. It goes up every year. But the reason it is linked in my mind is the enhanced tax credits and the way we have separated the market is because it was the enhanced tax credits in 21, I guess, the ARPA tax credits that really convinced me and my office to come forward and say that we thought it made sense to consider separating the market. I'll just mention there's other tools available to us. One of them I've mentioned earlier today, silver loading, and there an eye on you. One of them, and there are other tools available to us that are explored in the marketplace report. All of those tools are tools to help us in the individual market. Not a one of them, as my understanding, helps us in the small group. And so, I know traditionally over the years, the HCA has probably been more concerned about the individual market. It was a place of tremendous, we were worried about it back in the day, still worried about it. But today, when I look across the landscape of access to health insurance, I find myself more worried, or particularly worried about the small group. I think more and more employers are going to have a harder and harder time offering insurance as the costs go up.
Right.
Ellen?
The cost goes up, so what's your recommendation? We know cost goes up since I've been here,
Yes.
so we're looking for a fix. Now, we know that cost is going
So
up.
let me keep steering us back. This bill is not about any of that. And we should pass this bill independent of any of that. But if I could just say on a very high level, without going into the This is days of testimony to talk about why it's expensive and what to do about it. I just have to say price. We have a very expensive healthcare system. And we have to address that. Unless you've got a printing press in the basement where you can print some money, we have to address the price.
Leslie?
I guess I'm feeling worried that this may not be the time or the place for later or whatever. But we keep talking about the enhanced subsidies going away. But what if they go away on December 31st? You know, when are we gonna know? And how are we gonna respond? And that's what I'm worried about.
I think our opportunity to respond to the potential of them going away is this year, this legislative year. But I have to be honest, yeah, the timing is short.
Yeah, so if we're gonna be responding this year, how does that look?
Yeah.
And I'm not saying,
Yeah.
I'm not suggesting you mention that now, say, I want to think about, I don't know how we think about.
And while complex puzzle for this table to consider what steps should be taken this year without the knowledge that they will for sure. Let me just say, current law is they go away. Current law is they end after 2025. And so I guess my opinion, given the given who Congress is and who and the presidency, is that we plan for the reality that we won't have enhanced tax credits next year. I might be wrong, in which case
It'd be crazy, wow.
I would be really happy if I was wrong.
I didn't hear what he said.
He implied that if he's wrong,
Oh, yeah, okay. Oh, I hope you are.
Me too.
Just, I know we've said this many times. The bill that we have in front of us has nothing to do with that.
There's no impact on that.
No. All it is we're more putting in place
Maintaining the status quo.
what we're doing now. Permanently. And maybe we should be thinking about what you just talked about
Agreed.
and doing something about that. And that's why I'm waiting to see what comes through tomorrow. So that we can,
What's happening tomorrow?
Yeah, what's happening tomorrow?
is it tomorrow?
Tuesday.
When's the governor doing his?
Tuesday.
Huh?
Tuesday.
Oh, Tuesday, I'm sorry. So we'll wait till Tuesday and see what that is.
I think Woody has a question real quick.
I'm just curious, what do insurance companies think about maintaining the status quo?
I think you'll get to hear from an insurance company as soon as you dispense with me.
That's good.
Alan, did you?
Well, I've heard all this stuff. Healthcare has been around here a long time. And you folks, you've been here a long time. You guys have adjusted. You do what has to happen to make things go. And instead of talking doom and gloom about what might happen, we got to look what we can do in this building. And we can't find excuses.
Mhm.
So just keep that in mind.
That's fair.
Cindy?
So by doing this, it wouldn't kneecap anything that we would have to do in the future. Okay,
No, I don't believe so.
okay.
Maybe to say it a different way, the strategy of keeping the individual and small group, I believe served a purpose at one point, and I don't believe it serves the right purpose now.
So if we unmerge the markets,
It's already unmerged.
if we maintain the unmerging of the markets, if we allow it to continue, if we delay the sunset, whatever the right language is,
Mhm.
it applies to the calendar year, January 2026 to December 2026. And then during that year is when Congress has to make the decision if they're gonna extend the tax credits or not?
I don't know the exact date by which Congress would have to act, but it's well before January 2026.
So I'm just trying to like understand the timeline of things.
This bill eliminates, you're talking about a sunset. It essentially eliminates the sunset. It puts it permanent, that the markets will remain
Right. It
unmerged
eliminates it sunsets the sunset or whatever,
until somebody around this table decides that they want to merge them.
But I'm trying to understand is just the timeline of what's so in the calendar year, in this calendar year, Congress is going to make a decision that will then go into Congress either makes a decision or not. But the point is, I'm sorry if the technicality is wrong. The main point here is that we're going to make a decision to keep, if we make a decision to let them remain separate. And then after we go out of session in June, let's say Congress decides to repeal or eliminate or not allow to continue, whatever the language is, the tax credits. We won't have an opportunity to do anything to help the individual market if suddenly those people are.
Let me try and state it this way. The HCA supports maintaining an unmerged marketplace with the belief that we won't have the enhanced tax credits in 25.
I believe we won't have.
We won't. We support maintaining an unmerged marketplace, independent.
Okay, this is what I'm trying to get at. So it's like, it doesn't matter what happens. It's going to be better either way, is your opinion. Okay, this is what I was trying to get at.
Anyone have any other questions? For Mike?
And I would just make one statement, Madam Chair. If we came back here in 2026 and we found out that something that we did today was detrimental, people around this table can change it. They can do what we're doing right now.
But like,
I think that,
That's why you come back.
No.
yeah, and that I don't believe that anything that we're doing in this bill is detrimental to the small group market. That is unchanged. So this bill doesn't address that. And this bill doesn't address the individual marketplace or the federal tax subsidies. This bill really has nothing to do with that. It's just that was the reason for merging them in the first place. And so that's something that we need to be cognizant of in perhaps other legislation or budget or anything else that we want to discuss. So this bill does not address any of the issues that we have in the individual market.
Right.
Mari, did you want to say something? Oh, I'm sorry, Leslie. I just looked over in this direction and saw
Either market.
Just to go on with this timeline problem, I understand about this bill totally, that I know, going forward. But let's say in Topper's scenario, we go through this session, we don't have any response yet because we don't know information. Then we get information. By the time we can act next year, there's going to be a gap for a population of people. Probably. There will be downside effects. I have no solution clearly, but I'm worried. And that's just all I'm saying is that, yes, we can wait and be patient. Once again, I'm just wondering, can we get something in place to protect in case? And maybe we can't, and I don't know, it's certainly not my brief, but once again, if we don't, then there's this gap for a population. That's what we're down.
Lori, and then I'll say something.
Another question I was going to say, make a comment to that. I think what Topper said is what we have to focus on right now. We need to see the governor's address on Tuesday and then hear the report and take up testimony. I mean, the answer is money.
Yeah.
I mean, let's be clear with that.
Yeah.
The answer is.
What I was going to say is I just want to remind everybody of the chart that Diva showed us today that had the how much it costs to insure the individual market. I don't know if this is going on YouTube the right way with directional, and how much the premiums are for the small group market. And if we merge them back together, which would happen minus our inaction of doing anything here, because the unmerged goes away, then what would happen is that the small group and the individual group would meet somewhere around the middle, and I'm sure there's actuarial stuff but let's just say for all intents and purposes, they would meet in the middle. The small group market would go up significantly. The individual market would come down slightly. And whatever Congress does regarding the tax credits doesn't change anything significantly that the individual market would be losing, other than their premiums might go down a small amount. But in the meantime, the small group market would go up.
And that just leads me to want to say one more time, we have precious few strategies to reduce the costs in the small group. And we're worried about the small group. We have quite a few strategies. Going to take money, but we have some strategies to think about what to do in the individual group, how to respond to things that Congress does or doesn't do. But maintaining a separate individual and small group is the action you have to avoid what the chair just said, increase costs in the small group.
I'm sorry. Go ahead.
And there's no way that the DPA could be targeted just towards like the small business, like if you're talking about a small group of people. We have to do it.
We should have a big, long conversation about what to do with BPA another day.
Okay.
Right. What do
Just a comment. In next year's budget, I would never assume anything. But you would think that DEVA is planning for perhaps the inevitable loss of federal funds, and will have that in the budget for next year.
I hope you're right.
We get to see the budget Tuesday, I believe.
So the recommendation.
The recommendation.
The recommendation. Thank you, everyone.
Thank you. Thank you. Sarah, you want to join us?
Afternoon. Thank you. Sarah Teachout, representing Blue Cross and Blue Shield of Vermont. I'll state it very clearly. Blue Cross strongly supports passage of this legislation to keep the two markets separate permanently. And there are several reasons that we support that. I was going to start with a little history. So when the cost sharing reduction payments to insurers were eliminated, Vermont was the only state in the country that could not respond immediately to those changes, in part because we had this merged marketplace and it requires legislative action to separate them and do the silver loading strategy that we now have in place. It was pretty cumbersome. And I heard it incorrectly, so I'll say it correctly. Insurers are required to provide these benefits, the silver loaded benefits, to members who qualify for them. And the federal government in turn pays the insurer to cover the cost of those benefits. When the federal government stopped paying, we still had to provide the benefits. So it came out of our reserves. So that's what happened for 1 year. We became like every other state after whole group of us got together and recognized that it was a better approach for Vermonters. And that's the place we've been in. I think there's a lot of reasons to make it permanent. standing out and being the only state with this unusual structure when we're probably going to have to respond to a lot of federal changes that could be not beneficial for the residents of the state. It puts us in a position that's more similar to other states and makes it easier to respond. So that's one of the reasons we support it. We also support it for stability in the healthcare marketplace. I completely understand why the legislature did this temporarily at first and then extended it for a few years for a while we were all working out what could be done. But we need to make a permanent decision. It's better for the marketplaces to know where we're going to be. And then the last reason, the most important reason is this benefits Vermonters. Vermonters receive more money in federal subsidies through this program than they would if we remerged the markets. Again, we know that we don't really know what's going to happen. So that's the problem. And some of the things you're wrestling with. I would say I have no idea what's going to happen in Congress, but there is a coalition in Washington, D.C. being funded by the healthcare community broadly, providers, payers. It's called, I had to look it up. It's called Keep Americans Covered. It was started over a year ago. And what they've done, and they have an interesting website if you want to look it up, but they've quantified the benefits in every state of the advanced premium tax credits to the residents of every single state in the country. They've also calculated those benefits and showed, how many people are benefiting from it. And the idea is to educate members of Congress on how important this is for their constituents. So, I am hopeful that they will look at that and recognize the good it's doing for this country and the people who need those subsidies. So I won't labor it, but we really support the bill. We really also would like it to pass quickly. And the reason for that is we're already planning with the Green Mountain Care Board to make 2 filings for next year showing the rates if the subsidies go away and the rates if they continue at the federal level. And this adds another layer of complexity because then we'd have to have rates going away, merged marketplace, rates going away, unmerged marketplace, rates continue, subsidies continuing, merged and unmerged. It just makes it really complicated and very difficult to plan. So
And when
that's,
do you have to have your rates in to the agreement?
it's early in May.
When do you start planning that?
We've already started planning. Our actuaries are working on it. We file early May.
Okay, so it would be very beneficial if we did this as expediently as possible.
Yes.
So we need a decision on this.
Urge you and thank you for considering the vote.
Brian?
Yeah, I think, it's really clear that the decision is I'm rereading the report while you're both talking too, just to reduce the need to ask questions. It's really clear that it's beneficial regardless of what happens federally. It's not in this bill, but it's been referred to in the discussion. And so we don't have to get into this in detail today, but I wanted to just ask this, and then we could always talk about it later, that if the federal policy changes and people can't get those subsidies anymore, and then the people in the individual market can't afford the plans and they start dropping in 2026, what would be the impact moving forward on the cost of premiums if the pool starts to shrink?
Right. So some of that is in that report. There's an
Is this what I'm looking
assumption-
at?
Yeah, there's an assumption of how many people would forego health
Yeah.
insurance coverage because the costs go up. And then I don't think we know yet, but our actuaries would make an assumption about who drops and who keeps coverage. We all know that the people who are likely to maintain coverage are people who really need it. They're older and they're sicker, and someone who is perhaps younger and healthier might be the person to forego coverage. So then that makes the risk pool
Exactly.
less healthy and the premiums go up.
So what I'm hearing though is that it's unpredictable. It's very unpredictable what the impact of that federal change would be.
And there's also the other, it's not just APTC stays or APTC disappears, which is what we can plan for, but there's some negotiated compromise that Congress comes to, which could be good or could be bad. We don't know. It's very hard to plan for that kind of middle ground as well.
Thank you.
Anything else for Sarah? Thank you.
Thank you.
We were scheduled for a break. And then we were gonna have DFR in at 2:15, but I noticed that they're here. So if they would like to, just continue.
Sure.
Emily, if you want to come up.
Sure. Everyone.
Hello.
Good to see some of you again. My name is Emily Brown. I'm the Deputy Commissioner of Insurance at the Department of Financial Regulation. And I did want to ask, I know there's a few new members, if you want me to do a high-level overview of what our department does, or I can save that for another time and just talk about the bill.
Yeah,
Okay,
we have time. So
Okay.
yeah, let's just.
okay, so I'll
let's
just
do that.
do a very high level, and if you want me to come back and provide more details or talk about it in more depth, I can do that. So there are several different aspects of healthcare and health insurance regulation in our state. The Department of Financial Regulation largely oversees the commercial health insurance market in Vermont. So when I say commercial health insurance market, that doesn't include Medicaid and it doesn't include Medicare. So Medicare Advantage, original Medicare that is held by the federal government, and then Medicaid is held with the feds as well as the Department of Vermont Health Access, who I think you heard from this morning. So within the commercial health insurance market, there's a lot of different types of health insurance. The one we're talking about today is major medical health insurance, qualified health plans. Those are the plans that you think of when that provide comprehensive coverage and that you would buy on the exchange or you receive from your employer. There are a lot of other types of health insurance products we regulate, such as Medicare supplement, indemnity products, as well as, accident and sickness policies. For major medical, we have kind of a nuanced role. We are the enforcers of the Affordable Care Act at the state level. So while DVA administers the exchange, the Department of Financial Regulation enforces the federal laws and the state laws that apply to the Affordable Care Act. So we work really closely with them on these types of issues whenever they arise. And then for major medical health insurance, our department oversees the solvency of domestic insurance companies who offer major medical products. So in the case of Vermont, there's only one company, Blue Cross Blue Shield Vermont. And then we also approve the health insurance policies that are sold in the state for qualified health plans or major medical policies. There are some nuances there, which I won't get into. But then you have the rate review for most of major medical done by the Green Mountain Care Board, who we also work with whenever we're doing our rate review or our form review. There's kind of a stacked process and timeline that we all kind of work together on to make sure that that approval process happens. So we're here today because while, DVA is definitely the subject matter expert on the exchange and the subsidies, we are the department that has the enforcement authority over the insurers in this market and making sure that they're complying with our state law. Is that enough of a background? Any questions before I talk to the bill?
Just, how many insurance companies are licensed to sell insurance in our state?
Yep, so there's two different types of insurance markets. There's the fully insured market, which you could consider the state regulated market. I think I saw that Jordan Etsy from MVP, I think it was yesterday, come in and give you that pie graph, right? Where he kind of talked about the self-insured or federally regulated plans. And then kind of there was a grayed out section, which was the small group, individual and large group. So that's the area that we regulate. So within that area that we regulate, there's three insurers. There's Cigna, there's MVP, and there's Blue Cross Blue Shield Vermont. The rest of the commercial health insurance market is regulated at the federal level. They're called ERISA plans, or it falls under a federal law called ERISA, which again, I can come in and talk more about later. And that is not under state authority. So whenever we pass laws in Vermont, our laws do not apply to that self-funded or ERISA employer plan or health insurance plan. It just applies to our fully insured or state regulated market. And there's about 80,000 covered lives in that market right now.
All right, did you have a question?
Yeah, just wondering if you want to, it's not, it's related. Do you want to touch really lightly on how PBMs are involved with engineering?
Sure, yeah, so we do regulate other types of entities who have a role in the healthcare system. One of those is pharmacy benefit managers. So last year, the department received licensing authority over these entities, and what they do is they essentially manage the prescription drug benefit for your health insurance plan. So when you go to a pharmacy and you get your drug from the pharmacist, it's actually the PBM that is reimbursing the pharmacy for that drug, not your health insurer directly. So the health insurer contracts with the PBM, who then is charged with developing the formulary. So the formulary determines what drugs are covered, what cost share. They also do utilization management, which means that they decide how drugs should be used and can be used in some instances. So we license, actually January 1, 2025, any PBM who's newly operating in the state has to license with the department. And that timeframe they have is a year for PBMs who are operating right now in the state. They have till January 1, 2026. So we've set up a licensing page on our website. And I think we've received one license application so far. So we're starting to get into that process, which should be fun. But yeah, so PBMs are a very large part of our healthcare system. There's been a lot in the news about it. And I know a colleague, Sebastian Arduengo, he would be happy again to do a refresher on PBMs for your committee. I know he's been in here before.
I was going to ask if you would be prepared if we did have the department in.
Sure.
To give a report on how the licensure.
Yes,
process is going.
definitely.
I think you just answered.
Yeah, it's starting. Yeah, we'll see.
They could bring their one as an example.
Yeah.
Thank you.
Yeah.
Do you administer or enforce anything with third-party administrators?
Yes, so I'd have to look back. We have a regulation that governs how third-party administrators, TPAs, you'll hear that acronym. There's a lot of acronyms in health insurance and healthcare, so I'll try not to use them. But you'll hear the phrase TPA, and so that's a third-party administrator. And they, a lot of times for employers who decide to self-insure, so I talked about the federally regulated plans. What they do is they'll hire a TPA, third-party administrator, to administer their health benefits, the benefits they're offering to their employees. In that way, they're able to, have the formulary, have the benefit design, but it's essentially a company that's administering or operating the health insurance plan for the employer.
Any other questions before Emily moves on to age 35?
Great. So our department does support age 35. We worked with DEVA on this. And I don't want to, for all the reasons that they pointed out this morning, saving small groups money, more affordability mechanisms for the individual market than there are for the small group. And then really no clear advantage to uniform rating and plan design. So we support the bill and maintaining the unmerged market, the status quo as it is now, for the foreseeable future. And I will emphasize again, as several individuals have before me, is the timing. So we do have a March deadline. DFR is the entity that would be filing for any changes with the federal government for adjusting our market structure. So we do urge the committee to move quickly on this and support this bill.
Right, and you have I'll ask the same question. You have no problems with any of the other sections of the bill?
No.
Just the technical
Yeah,
changes?
technical corrections also we support. Yeah, I think it's a good opportunity to clean up some of the language.
Great. Well,
Okay.
thank you.
Thank you.
If there weren't any questions? No?
I have a question for you, not for Dennis.
Okay.
or for the committee, not you, but it's through you to the committee.
Okay,
We haven't heard from anyone yet who has expressed any opposition to this, right?
not as of yet. We do still have one more scheduled witness. This might be a good opportunity for, me. We reached out to, several entities to see if they wanted to comment. It is my hope, with the expediency that everyone, I think, has expressed to us, that tomorrow we can have committee discussion, the final markup of this, and that we vote this out tomorrow.
That's what I was getting.
So for anyone who's listening, wants to comment or wants to speak on this bill, then I would suggest that they contact us and can submit written testimony. But we probably will be voting this out tomorrow.
That's what I was getting at, kind of like seeing if you were ready to like make a last call for witnesses kind of thing. Yeah, so 24-hour notice, like last call, if you have any opposition, it's in the House, it's your chance.
Last call.
Yeah.
I think we're gonna go, is Megan in the room? By any chance? She wasn't scheduled until later, so why don't we take a break?